Thank you, everyone. So we're now going to transition to the report out by table. Julian?
And we had some extremely interesting discussions on our table. I hope on other tables too. Just in terms of time, could you just give your one person off each table, just give your top takeaway from each of those two feedbacks? So in terms of people's ideas, any common denominator thoughts from what are the social determinants, your own reflections, and then the learning commitment. So Carl, do you want to, who was your rapporteur?
I'll speak just briefly. I mean, we were reflecting on a number of things, but so 2 points I think I can make that reflect our conversation. We talked a bit about the social determinants of mental health and how we framed it this morning. And one of the things that we were thinking about is how we may want to frame it as social determinants of the inequities in health, which allows us to really kind of bring it into the lens that allows us to take it to a policy level, really like channeling the conversation. And the other thought that I would share with reference to the second question on there is in terms of the accountability of the health worker to address the social determinants of health, and how there are in our triangle here the three domains of education, community, and organization. And here today we're sort of sitting as the global forum of health professions education, so we're really thinking through the education lens and the responsibility for us to educate health professionals so that they are aware and informed of social determinants of mental health and health. But then there's also that connection to the community, and we'll talk later on a bit about how we can bring that sense of motivation into the individual to take those actions. But then there's also the responsibility of the organization to create incentive structures to be able to empower and even incentivize, motivate that health worker when the rubber hits the road. So we were thinking more at not the personal level, but we were sitting at the systems level trying to internalize that question.
Great, very good. Perhaps go back to sorry, I missed that, the first table.
So Julian, we actually thought that you were going to report out on our table. But I'll jump in anyway. First, we had a really valuable exercise in just sort of identifying some of the vulnerabilities that lie right below our surface. But then we ended up having a conversation about how complex social determinants are and how it's tempting to simplify. And sometimes even using the term social determinants of health is perhaps a simplification that these things may or may not determine. There are social factors that create risks for some people, and there's others that have protective factors, and that we need to keep that in mind.
In terms of the learning? The learning aspect?
Yeah, we didn't get there.
Yeah. Very good. Thank you very much. We'll go around and
we actually had some interesting discussions from a individual family to larger like a VA system, and trying to extrapolate some of the conversations and recognizing that perhaps not throwing money at it isn't a solution, because it's much more complicated when you actually live in those individuals' lives, and how one piece is really intricately related. It's like a cog, you fix one and the other ones are together. We talked about the VA system as perhaps a system that might show greater efficiency, recognizing at a point they had a backlog, and then that creates a problem if it's not efficient. We were working harder, I think, at the changing the conditions that make people sick in the first place. And that's a more challenging situation to have a conversation if the person has a support system where they are and all the system is there and you're asking them to change that, but that support system is what's keeping them afloat, then you might take out, for the sake of something that's good, actually pull out the bottom of it. And so that one is harder for us, that it's not as simple as just, you're in a bad housing system, move. Well, what if the whole support system is in that neighborhood, and moving fixes the one problem, the health, but now I've lost my entire family and support system and what I have. It's not that simple. And so we didn't get to the learning contract, we'll confess. But we were struggling with that because it's not a Band-Aid. It's not like a plug a dike someplace because 3 other holes will open up at the same time. And that's where we were having a bit of a challenge. And maybe somebody else has a solution to that.
Very good. Excellent.
Yes, and we talked about in our own stories, one of the themes that came up in talking about our own stories with social determinants of health and mental health is that you can have 2 people go through exactly the same challenges and come out with dramatically different outcomes. And we don't always understand why. One person may thrive and another person may really struggle. The other thing we talked about is having experiences with people who are struggling with these kinds of issues can really help us destigmatize these issues, destigmatize mental health disorders, and that role modeling, how important role modeling is in helping us do that. And as far as the second question, we didn't talk about that a lot. We, of course, agreed that no, you cannot educate and train health workers without understanding backgrounds. And one of the cautions that came up is when we are exposing our students to people in different phases of life with different challenges, that we be very careful about stereotyping. So the example that came up is like exposing our students to older adults, and they see only the older adults who are incontinent and really struggling, and they don't meet the 80-year-olds who jumped out of airplanes, and understanding the depth and breadth of people that we're exposed to. Thanks.
Very good. Table 5.
There we go. Okay. So I think in our, we shared a lot of our different stories, and I think the common theme that came out of that was in order to work with individuals and to consider the social determinants, that we need to be sure that we are considering the patient-family perspective, understanding that families come as they are. It's important to join the family where they are in their journey, and to consider that, not only that perspective, but I think as providers and potentially as we educate others, to understand that we need to be aware of our own biases and how that might impact our interactions and our planning, and how we're trying to help others, families, solve some of these issues. Anything else?
Thanks very much. I've just been flagged where obviously it's important to get this feedback. There will be chances throughout the day. So, I mean, what we're hearing is some of the education, the accountability has been mentioned, and really the overriding message from all these tables has been pretty much the same. It's really, really complicated. It's as people were mentioning here, you pull one string and it has an effect. So it's very, very connected. With what's been said, leaving the other 3 tables and the overflow, is there anything else that people felt that hasn't been mentioned that they would like to in terms of those 2 questions? Or
Okay, so we had a lively discussion over here, but we were stating that maybe we should work more collaboratively across organizations and city lines and county lines, especially when we're dealing with gun violence, treating victims and perpetrators and then sending them back to the same community that they developed their trauma from. And so I was stating that when I was working with veterans with PTSD and homelessness, I will send them to Baltimore, I will send them to Delaware, places like that, to change their surroundings and their environments. And it actually worked. And I think we should be more collaboratively across those lines instead of working in silos.
very good. So last, one more, gentleman.
Just briefly, when we talk about the social determinants, we determine that that these inequalities are important, an important part of who each of us are today, and that all of us had our own unique stories and how they impacted us. But one of the things I'll just say briefly is that at this table, we talked about how they impacted us long term, not only as a child through adolescence and adulthood, but they motivated us into the profession. And while in the profession, they shaped our core values, our passion, our motivation, and our drive and desire to see change. And so there were some positives that came from this as well. And so I think as we move forward, as we look at these situations, we need to look at both the pros and the cons and listen to the survivors, and I'll use the word survivors, voices, and honor those voices.
Very good. I'll wrap up there. I think that's a fantastic note to end on, because I think what we've heard is it's complicated. You know, even the word itself is not easy. But I think with the passion and the commitment we have in this room, we can make a difference and change. So with that, I think I'll hand back to...
Thank you, Julian. So with that, I'm just going to ask you to thank Julian with a round of applause. And I'd also like to thank your lively discussion, your input and feedback. And we are now at break, and we'll reconvene at 11 a.m.